as soon as he calls in, we'll give him another couple of minutes, and then we're going to get started. And if he's going to be more than a couple of minutes, I'll go ahead and ask Dr. Duffy to get us started with some information. It's been rumored that there may be a patient up in the North Country that has the novel coronavirus, and we have a patient under suspicion of that virus here. So I wanted to make sure as we start that this discussion off tonight on other healthcare matters and to talk about the year that we've had and where we're going, we first wanted to address this right out of the gate. So as soon as Dr. Chan gets on the line, we'll make sure he can join the conversation. But Dr. Duffy, maybe you can get started as we go. All right.
Okay. Hi, everybody. Good evening. So I'm just going to give you some facts here. Whoa, sorry. On Thursday, we admitted a 19-year-old patient from an outside health facility with mild respiratory illness. The hook was that this young gentleman was from Wuhan, China, and had just arrived back in the United States. He was immediately placed, he's brought to our facility and immediately placed in a negative pressure isolation room in our inpatient unit. Standard contact precautions were also implemented by our staff. Lab specimens were obtained and transmitted to the New Hampshire Department of Public Health Thursday evening, and we actually received results ruling out influenza. We had an in-house test that also did that, but a more robust test from the state ruling out influenza and some other well-known respiratory illnesses. So we received those results immediately. The specimen was then sent on to CDC-P in Atlanta, or the Centers for Disease Control and Prevention in Atlanta, for specific coronavirus testing, and we're awaiting results. We understand that we may have results tomorrow, and we actually should have results tomorrow. So I will tell you that the patient received supportive treatment. He is currently symptom-free and bored, but he's in respiratory isolation in a negative pressure room. The next steps in his care will be guided completely by the Centers for Disease Control and Prevention. So our staff did a wonderful job. I know Corinne, who's our Vice President of Patient Care Services, and will agree with me, and Bob as well, and all the trustees and all the staff. Our staff did a wonderful job. They knew exactly what they were going to do, and they performed beautifully. In general, we have the knowledge here and the experience, but in this case, importantly, the modern facility and the modern equipment to properly care for this type of case, and we did so. I have to, the doctor and me, and Dr. Chan would agree with me, we kind of chuckled about it on the phone. I have to remind you that influenza still remains a more virulent threat to our community's health. In any case, the patient's doing wonderfully. He's wondering when the heck he can get out of here. But again, we'll get the testing results. But at some point, he's going to have to be discharged. We wait for CDC to tell us that. I guess we can take some questions while we wait for Dr. Chan, but it's really quite a simple case. What Dr. Chan is going to do is just give us a background on what's going on in the state and not anything specific to this case.
So any questions on this as we get started? And as soon as Dr. Chan does call in, we'll go ahead and put him on, and he'll give about a 4 or 5 minute presentation. He won't be able to take any questions over the phone because we're going to use my cell phone to try to connect on that. But why don't we get started without any questions on a regular presentation? Yeah, sure. Yeah.
I want to say, I got to hit you over the head with it. There is absolutely no threat to the community whatsoever from this patient. There is absolutely no threat whatsoever to our staff or our visitors, and certainly our staff from this patient. So I just want everybody to understand that. Go ahead, yeah.
Is this the only suspected case in the state right now?
I have secondhand information that there's another down south, but you're going to have to get that from Dr. Chan.
You may have it right here.
And here he is.
I know everyone's staring at me, waiting for a dial tone to connect in. Dr. Chan? Failed. I promise you this worked a few minutes ago.
Hello, this is Ben Chan, Public Health.
Dr. Chan, it's Bob Nutter at Littleton. We're in the public meeting, and I was going to put you on for your presentation at this point. Great. Okay, I hope everyone can hear you, but go ahead and start.
Yeah, can you hear me okay? Am I coming through the phone and the speakers?
I'm getting thumbs up.
Okay. And I believe Dr. Duffy was going to give a little bit of an introduction, as he already provided some background.
Yes, he has.
Okay, great. Well, I'm not sure who all is in the audience, but I want to first thank Littleton Hospital and for reaching out to us and for working with us in this difficult and potentially confusing situation. I did want to just back up a little bit and give a broader overview of what we're dealing with nationally and globally with this new emerging virus that we're calling the novel coronavirus. I'm not sure of the familiarity of everybody in your audience with, medicine and infection, but coronaviruses are a large group of viruses that cause infection in both humans and animals. And so there are coronaviruses that naturally circulate every year, causing infections in humans. And a lot of times those coronaviruses cause simply common cold symptoms. What we've seen, though, over the last 10, 15 years are that some of these viruses have the ability to jump from animals into humans. And so we saw this back in the early 2000s, I think it was 2003, with SARS. People remember the SARS outbreak nationally, and then more recently in around 2013 or 2012, 2013, with MERS viruses. These are both other types of coronaviruses that were new to humans. And so as a result, we saw them spread globally and cause a range of infections, sometimes serious infections. And so we're seeing something similar happen now with this new emerging novel coronavirus that we first heard reports about at the end of December, beginning of January, coming out of Wuhan City, China, which is a city in Hubei province, China. And so initially, patients were presenting with, there was a cluster of patients that were presenting with a viral pneumonia, viral lung infections of unclear cause. And all the testing at that time for routine pathogens like flu and even testing for other types of coronaviruses like SARS and MERS were negative. And it was only in the last few weeks that they identified, initially the Chinese government identified a new coronavirus that we're calling the 2019 novel coronavirus. And so initially this was identified to be causing infections, again, in Wuhan City, China, specifically Hubei province. And over the last 2 weeks or so, we've really seen the number of infections identified expand quite rapidly to include other parts of the Hubei province, other parts of China, and even other countries around the world. So I think that at latest count, there's 15 different countries that have identified infection with this virus, including the United States. Over the weekend, the Centers for Disease Control and Prevention confirmed a fifth infection in the United States with this new coronavirus. So currently we have 5 people in the United States identified with infection with this new coronavirus. Those are in the states of Washington, Illinois, a couple in California, and then one in Arizona. On top of that, the CDC is also reporting that there are over 100 people around the country that have been identified as what we call people under investigation because of their combination of risk factors for travel to this area within China, Wuhan City, Hubei province, and then came down with symptoms within a couple of weeks after travel. And so the CDC currently is in the process of testing over 100 additional people this new virus infecting, individuals in our communities. So what we're seeing in New Hampshire is something that is, playing out also across the country and in other states. I think the good news is that we have been able to rapidly identify what is causing some of these infections around the world globally. We have a test that we're able to test for this infection in individuals. Currently, the testing capabilities to look for this new coronavirus only reside at the CDC. That's the Centers for Disease Control and Prevention. And so any testing has to be coordinated through our public health laboratory and then sent down to the Centers for Disease Control and Prevention for testing. But there are plans in the coming, few weeks, 2, 3, maybe as long as 4 weeks, for some of this testing capability to be rolled out to state and local public health labs to be able to facilitate some of the testing. So what we have asked providers around the state to do is to begin screening patients for travel to Wuhan City and Hubei province, especially patients that are presenting with either a fever or a respiratory illness. And we've asked providers around the state if they have patients that present with a fever or a respiratory illness, and also report travel to the Wuhan City, Hubei province area of China in the 14 days before they develop an illness to call public health and report it so that we can assess risk, make sure that the individual is appropriately being taken care of, make sure that they're out of the community, what we call isolation, and to facilitate testing. And so currently in New Hampshire, we have 2 individuals that we have identified who are undergoing testing through the Centers for Disease Control and Prevention. Those test results are not yet back, but both of these individuals in New Hampshire have presented with more mild illness within a couple of weeks after travel to the Wuhan City area in China, and are currently stable and recovering. So I think the process that we're in right now is sort of typical public health investigation work, where the first step, anytime there's concern for infection, certainly with a new infection like this novel 2019 coronavirus, the first step really is to confirm whether these individuals are infected with this new virus, and then if positive, to initiate a contact investigation to identify people that may have been exposed. But we want to assure people that the testing is underway. These individuals are being appropriately cared for and recovering. They don't have serious illness, and are appropriately isolated, so they're out of the public. They're not, there's no risk to these individuals. There's no risk to the public from these individuals currently in the community. And right now we're waiting on testing. And so we expect testing to be back on one of these individuals in the next 24, 36 hours. That's, I believe, the situation that Littleton Hospital is talking to you about currently. And so once we have that information, we'll be able to make a more informed decision about whether there may be further investigation that's needed. But if the testing is negative, then we can very clearly say that there is not any and has not been any risk to the public from this individual that came down with a respiratory illness and after travel to Wuhan City, China. Let me stop there and see if Dr. Miller, if you have any additional questions or points that need clarification. I will just reiterate again that the individual that I think you're currently dealing with and talking about, that the CDC has just received the specimens this morning and are undergoing testing, and so we hope to have results back potentially by tomorrow, but sometimes there can be delays, but we expect to have more information in the next 24 hours, hopefully.
Great. Well, I think that probably is the most we can speak about right now. We'll have more information in the next 24, 36 hours, we hope. And as soon as we have that, we'll certainly update this and provide more information to the public and through a press release that we'll send out and on our social media sites.
Yeah. If I can add one more thing,
Please.
if there's any media present in the room and they have questions, additional questions or concerns, they should reach out to our public information office. And if you hear about any individuals in the community that may have concerns, they can always reach out to our public health line here in Concord. That number is 271-4496. There's an answering machine that after hours will direct people to an on-call number if there's a more emergent question or situation. But we're available if there's public questions or if further information is needed. Again, the number is 271-4496 for the public. And I do want to also just give a nod that anytime we have these new viruses or new infections that emerge, we take a very active approach to trying to identify and contain these infections. So that's happening both at a national level with the CDC. They're helping with the testing, certainly, but they're also screening, doing airport screening, travelers that are coming into the United States from the area of China. And at a local level, we're working very closely with healthcare providers, and hopefully this call is an example of to identify patients that may be at risk or potentially have a new infection, to get them isolated and the appropriate testing and care. So we want to, again, thank you for including us in this conversation, and thank you for reaching out to us and partnering with us on this.
Great. Well, thank you very much for your time this evening. We greatly appreciate it, and we'll be in touch.
Great. Thanks so much.
Thank you.
Take care.
Bye now.
Bye.
Okay, that worked. So we'll be around as soon as we get through the normal annual report presentation that we have, and Roger's going to come up and actually kick us off as our chairman, as we always do. But we'll be around afterwards if there's other questions. Dr. Duffy will be here, and certainly he can answer questions as we've been in close contact with the CDC and the state since last Thursday. Been working very closely with them. And honestly, I couldn't be more proud of the staff that we have here and the way we've handled this and managed this. So thanks to everybody that's been involved with this so far. Roger?
Thanks, Bob. I've been following this situation, and certainly I'm not going to talk as much as this guy did, because he was pretty highly winded. But I would have to say that that when we get done this, we're going to do a root cause analysis. Our team, I followed this from the beginning, our team of specialists did a wonderful job. If I had to share any concern, is the time lapse. We were willing to fly that sample Friday morning down to Atlanta, and they just received it this morning. That's very disappointing. That's appalling as far as I'm concerned. And we've got to find a way to close that gap. And there's a lot of moving parts. There's a lot of things happening in this country, and there's a lot of chaos. But I think we tend to be the forgotten child up here in the North Country. I probably shouldn't say that because I'm probably going to get in trouble for it. But I think it's important to know that we have the very best healthcare system. I think Dr. Duffy highlighted very well. So why don't we just go ahead and get started. What I wanted to do was come back to that previous picture, please. This morning we were looking at these slides, and I told Don that we needed an asphalt job because that front parking circle was full of filled holes with black tar that you'd see on the interstate, and so we thought we'd, at least for this photo, do an asphalt job. So I think they did a pretty nice job for a winter scene, wouldn't you say? So I've been fortunate to be the board chair now for the last year. This is our 113th annual meeting. I first want to thank the patients, the community members, the staff, the volunteers, the press, and certainly all of you for coming out this evening. I think in past years we've had a weather condition that has not always been conducive to getting people out, but it's always a pleasure when you can come listen to what the community healthcare system here in Littleton has to offer. So this last year, and the Board of Trustees is focused on setting the strategic direction, assuring ourselves of financial stability, and certainly this year's financial results will be covered by Aaron, and we've had some challenges this year. and provide the highest level of quality medical service in the community. And if you were to look at the quality measures that we have here in Littleton, by far they're exceeding what is being offered by other parts of the country by quality standards. And certainly our main role is to support the executive staff, the members of Bob's team, and that's, our main role is to be that community leader. So on the agenda, you have this agenda, so I won't spend much time covering it. But each of these individuals will speak to their level of expertise, their role in what service they provide to LRH. And I think you'll conclude at the end that these individuals will show what has happened in their respective areas, and certainly the opportunities that present themselves. So as we look at the structure, we have a volunteer board, truly a volunteer board, an excellent board, a board comprised of many individuals that come from different disciplines, and we'll share that to you in a minute. We've got Bob, and we've got Dr. Rocky from the president of the medical staff, and then we have the executive committee that meets on a very regular basis. The leadership from the executive committee is an individual group of individuals that really work very well together as a team. And the key is to be able to work together in the common interest of the board as well as the hospital it serves. We have some new board members that have just been elected: Catherine Fleury, Dr. MacArthur, and Thomas Tremblay. These are three individuals that are going to be added to our board at our next meeting. Go ahead. So in looking at the board members, and we put these in years of service, Dr. Dean Rankin, 8 years, myself 5, Aaron Hennessy 5, Jeff 5, Dr. Fitzpatrick 3, Elizabeth Coons 3, Laura Morgan 3, Ed Chinchilla 3, Dr. Goldberg. You can read these for yourself, but you can see that they're really comprised of a group of individuals that have different terms, and the intent of those terms is to be able to keep the board in really an evergreen approach so that we are able to have board members that come in with new inspirations, new ideas. And what we don't want is a board that stays on forever, because there'll be some complacency, and again, the goal is to have a very active board that can provide strategic direction. Certainly would like to take this opportunity to thank the volunteer board of trustees, and if you're here, would you stand up, please? Okay, these are the board of trustees. I attend the volunteer annual meeting that they have, and we have over, 150 volunteers? 200. Any of those volunteers here this evening? If you would, please stand up. Stand up. It is absolutely amazing, and when I'm in here on a very regular basis, you'll stop and ask them, well, why do you do this? Or when we're having the dinner, why do you do this? They are just wonderful. I mean, they're individuals that move patients around, greet people. They're greeters. They're the ambassadors to LRH. Medical staff, stand up, please. Those of you here in the medical staff. Physician-led, that's very, very important to this organization. We have an engaged group of medical staff members, and we can't do it without them. Management, sometimes known as overhead. They're the individuals that provide the leadership, and they collaborate with the medical staff, and it's what turns the wheel of success. Employees, stand up please if you're an employee. Okay, before I get into what is critical access hospital, one area that I missed early on was when we talked about strategic direction. This last year, the board embarked on a strategic direction initiative where we brought in a company called HALSA Advisories. They work with many hospitals throughout the country. What they did is they came in, they did a turn Littleton upside down. They took data at its micro level. They look at the type of services that we provide, the geographic footprint that service is provided from. They looked at the facility in itself, its capacity, its capability, and then they sat down and we had a team that worked at length to look at the vision of LRH, what we needed to fix, and what areas that had to be addressed. Certainly one area was the ED area, and of which Dr. Duffy is led for so many years. It wasn't until this summer that I spent a day in the ED for what I thought was a possible heart condition, which was false. But I share that with you as a personal nature because I really hasn't shared this publicly, but I spent a day in the ED behind a curtain, okay, that had no privacy, that had patients going in and out. And I saw the backside of one lady, which probably shouldn't have saw, but I say that out of pun. But that's privacy. I mean, ED is an important piece of our organization. And that's an area that I left there saying we had to do something about it, okay? So when we looked at that facility, we take things for granted. So this HALSA study came up with many different ideas, which you'll see a little bit later. So rural hospitals, we're the largest in the state. We deal with financial vulnerability. We have to make sure we're accessible, and we have cost-based reimbursement, which basically means that Medicare and Medicaid, we make little to nothing. And keeping in mind that we're a non-for-profit, we understand that. But I think the most important things we have to understand is that we have to have a little bit of a margin to grow and to expand our services. And Bob will speak later to that those services really expand on the patient after the patient becomes a patient, but treating a patient on the preventive side, the wellness providing side, and the emergency side. So we're focusing on expanding that to be more forward thinking about the level of service we're going to provide. And we're positioning ourselves for the future. That's an important piece. As we've done this last year, the board has been fully engaged. We've had several meetings. And so positioning ourselves for the future means thinking and acting and doing differently. Today, with an aging population, we just can't repeat last year. We got to think on a forward base. And my wife tells me that almost every year, so I have to stay with her. I can't go anywhere. So, good. Thank you, and I think that's it, Stephanie. I'd like to introduce Jeff Woodard, the Vice Chair. Jeff has been a great team member. We collaborate very well together, and I think it's important that Jeff says a few words. Hopefully he'll give me some accolades, I'm not sure. Jeff.
I noticed the microphone was set up for you. We'll get a bigger one next year. As I'm sure you're all well aware, this last year was a pretty interesting year for LRH. A little over 3.5 years ago, LRH entered into an affiliation agreement and became part of North Country Healthcare. This agreement had a clause in it which allowed any of the affiliated hospitals to opt out after the 3-year trial period. The agreement originally stated the withdrawing hospital had to show cause for withdrawing, but was changed in the final document. And you no longer had to show cause because everyone felt that this would only cause more tension amongst the group. You may have seen several negative articles about LRH and its board members in our local newspapers, most of which were not true. Our board chose to take the high road and not engage in airing our differences in a public forum for the exact reason the clause was changed in the agreement, stating the withdrawing hospital did not have to show cause. After 3 years of participating in affiliation, our board, which is made up of doctors, lawyers, finance, educators, public safety, state representatives, CEOs from another medical facility, local business people from our surrounding region, including some of the largest employers, and after extensive due diligence, voted unanimously to withdraw from the affiliation. We have a very dynamic board, and that was a unanimous vote. Our board knew there was a significant cost to the withdrawal process, but felt strongly that operating independently was in the best interest of our hospital, our employees, and would allow LRH to provide the highest level of care for our patients in our community. So that's what was behind the whole process, which we're quiet about. We weren't going to publicly go through this and air this in the newspapers, but that's from the board of directors at LRH. Thank you. Next up is Aaron Hennessy to go over the financials.
Thank you, Jeff. As Jeff said, my name is Aaron Hennessy, and I am the treasurer for the Volunteer Board of Trustees. As treasurer, I am glad to report that LRH continues to be a very financially stable healthcare institution that balances its mission to provide quality, compassionate, and accessible healthcare, assist those who cannot afford care, and operate in a fiscally responsible way. 2019 key stats. In 2019, our revenue was in line with our budget expectations at $181 million. Net revenue after all of our contractual deductions and free care was $90 million. As you can see, we had a negative operating margin to end the year, but if we remove the direct separation expenses, we could have ended with an operating margin near break even at a negative $118,000. In looking at the first quarter of 2020, we are above budget and we continue to strive to lower our costs while still providing the highest quality of care to the patients we serve. As a reminder, as a non-for-profit healthcare provider, it is not in our mission to make a profit. Each year our goal is to make only enough, as Roger said, to reinvest in our facility and to meet the needs of our community. We currently have $103 million in assets. LRH remains a very healthy organization from a financial perspective. Our balance sheet and assets remain stable. LRH has a strong local and regional presence. We are the hospital of choice for many, and the number of patients we serve continues to grow. In 2019, we had 136,000 patient visits. In addition to being your neighbors, friends, and family, our employees are our best asset here at LRH. Those who serve LRH's patients are very professional. You can see our staff growth over the past year has increased by 11%. Our board-certified fellowship-trained physicians and providers have increased by 25% in the last year. Bob will talk about our new service lines that drove the increase in our staff when he speaks at the end. Littleton is proud to be the largest employer and one of the best organizations to work for in the area. Although our revenue has increased each year due to our increase in patient visits, our percentage of revenue collected has declined, and there are four main reasons for that. First, the quality of accounts receivable. Sometimes we don't get paid for services, even though the treatment we gave was the right thing to do for the patient. Number two, our increase in kind of patients that we see. For example, we have a large increase in behavioral patients. Most often we get paid very little for these patients or not at all for this type of service. Or an increase in patients that qualify for reduced or free care. Number three, we have an aging population in the North Country and all over the state that uses the government as a payer, which is Medicaid or Medicare. These reimbursement percentages, especially Medicaid, are very low. And finally, insurance contracts. Just like any business, our insurance contracts have been paying us as little as possible. We continue to anticipate the declining net revenue percentages in our budgeting process each year. LRH continues to provide the highest quality of level of care possible to all, regardless, no matter their status or ability to pay. In the past 2 years, we have seen a steady increase in the number of patient visits. Our volumes are growing mostly in the clinic area. It's the purple section. Bob will speak about our growing service lines for our healthier community. Thank you, and next I'd like to introduce Dr. Robin Hallquist to present the medical staff report.
Thanks, Erin. I'm Robin Hallquist, as she said. I'm the outgoing medical staff president, and it's been an honor to serve. It's been an interesting year to be president here. We managed to accomplish many of our goals. We continue to foster collaboration and cooperation with the board. We've improved communication while aligning with the new hospital initiatives, which has been an interesting thing to do. I want to acknowledge Dr. Duffy, who worked very hard on a quality improvement plan. It allows individual departments to establish their own quality goals in line with the best practice guidelines to help us better care for our patients. It's a really robust document, and I think will do a lot to foster patient care. So one of the things that we did this year was establish a physician compact, which is a document also to foster excellence and collegiality among the staff. We spent several months putting this together, and it encourages a focus on patient care, collaboration, cooperation, collegiality, participation, and innovation. New physicians and providers are going to be asked to sign it along with their contract so that they know what's expected of them here from both a professional and a behavioral standpoint. It's one of the ways that we are trying to make Littleton Hospital the very best place to work, and we think it is. I'd like to thank administration, the providers, the staff, everybody who supported me during this year. I thought we did a lot in the short time that I was here. We increased the staff, as Erin said, by 25%. And you can see several of the new physicians that are here, the advanced practice providers. And Bob will talk about what a lot of those people will be doing as we increase our product lines. We're very proud to serve this community. Being a doctor in this community is an honor. It's an amazing experience. We have a wide variety of patients from both a professional standpoint, from an economic standpoint. It's a really great place to work. I remain optimistic that Littleton will continue to grow. We have a terrific new president starting, who has already started in January. And I'd actually like to introduce her, if you can wave. Alice Rocky is the incoming medical staff president. And she will do an outstanding job. I think the fact that she's here will really serve her well. It was an interesting experience to be away from the hospital. It was still an amazing experience. And finally, I'd like to introduce Corinne Saperchi, who is who will provide the patient care services report. Thank you very much.
Thank you, Dr. Hallquist. In my role here as the Vice President of Patient Care Services and Chief Nursing Officer, I'm very fortunate to work with our extremely talented nursing staff and ancillary clinicians who work 24/7 to provide great care to our patients in our community. 21st century nursing is the glue that holds the patient's healthcare journey together. Nursing is at the bedside around the clock. We're very fortunate to have a robust nursing staff that is comprised of registered nurses, licensed practical nurses, licensed nursing assistants, and certified scrub techs in our OR. These staff cover 16 different hospital departments and 7 physician practices. In addition to providing the care, they're constantly growing clinically to improve the care that they're able to provide. Currently, 33% of our LNAs are enrolled in nursing school to become RNs. 20% of our RN staff, RN and LPN staff, are working on higher degrees, either at the bachelor's level or master's level, which just shows their commitment to the best patient care possible. Above and beyond the direct patient care that they provide, LRH offers a clinical advancement program that rewards bedside nurses for going above and beyond their clinical role. Last year, in 2019, we had 11 nurses who participated. Over the course of the year, they work on activities in each of these 5 domains. Their activities include peer education, patient education, volunteer activities throughout our community representing LRH, activities to improve patient care, to grow themselves clinically. We have an amazing nursing staff that is always looking at how to improve the care that our patients receive. LRH, I think, is very supportive of nurses and providing opportunities for them for growth. I've been a nurse here for 23 years and I stayed here because of the opportunities that LRH provides. Our nurse managers and department leaders work with the staff to find out what are their goals and help them to get there. That may be moving from one department to another. We really strive to maintain and retain our staff by providing them the opportunities here. LRH is a very sought out clinical site for area high schools, for job shadows, as well as for nursing students. You can see we are contacted by universities throughout the state to be able to send their nursing students here for a very diverse rural health experience. And they have the ability to be mentored by our top-notch nursing staff. And this list is continuing to grow. We have other universities in the state that we're currently working with to be able to host their nursing students as well. I think that speaks to the caliber of care that's provided here and the caliber of the nursing staff who are willing to take on that next generation of nursing. This year, we've always had a partnership with Dartmouth-Hitchcock, and we have worked really hard over the last year to expand that relationship through the use of telemedicine. We expanded these services to critically ill patients, so we have tele-ICU, which is the intensive care unit, tele-ICN for the intensive care nursery as part of our maternity unit, teleneurology, televirtualist, which includes infectious disease, gastroenterology, pulmonology, and cardiology, telerheumatology, psychiatry, and pharmacy. Our investments in telemedicine makes it possible for our patients to have not only our excellent care at their bedside, but the backing of a tertiary care facility with 24-hour monitoring support so that patients are able to stay in their community. Since investing in the telemedicine services over the last year, we have had numerous patients that previously, without these services, would have been transferred out of our community hospital to a tertiary care facility. By having this level of expertise, those patients are able to stay in their own community at their hospital with their family around them. It's really made a difference in the care that our patients are receiving in this community. Thank you. And I'd like to introduce Gail Clark, who is going to provide a fundraising committee and LRH auxiliary report.
Thank you, Corinne. I'm Gail Clark, the Director of Marketing and Community Relations and Fundraising at LRH. I'd like to start by saying thank you first to Ashley Garrison, who is the chair of the fundraising committee, And then the other members of the fundraising committee, if you're here, would you please stand up? And I know you're here. I think they're bashful. 2019, we did not conduct a capital campaign, but we continued to raise funds for the hospital. Because of the generosity of 340 individuals and businesses, we raised more than $175,000, and that's in cash donations, honor memorial gifts, planned gifts, and sponsorships. And we also received 70 in-kind donations, and those are gifts of gift cards or stays at hotels or dinner to augment the special events that we do. This year, more than 60 patients supported our fundraising efforts. We do 2 direct mail campaigns annually, and each campaign tells a story. It's a patient story. They actually we talk to them and we interview them, and they tell us about the care that they received here. And we put that in the form of an appeal, and we have found that to be extremely effective in fundraising. It lets the people that know us hear a story about how we care for patients. And because of that, 60 patients supported the appeals this year, and that's 60 new patients. This year's Dr. Moose Golf Tournament set a new record. We net $44,000. That's pretty impressive for a golf tournament. It's full every year, and in fact, this year we had to add additional 9-hole players. And if any of you are interested in playing this year, you might want to mark your calendar for Friday, August 21st, because it does fill up very quickly. Our annual Women's Health Conference, while it's not a fundraiser, we do get sponsors, and we are fortunate enough to net a little bit to put aside for the next year's conference. And we did net approximately $3,000 after expenses, so we're really excited about that. When Bob first started working here, that was one of the things that he challenged me to do, was to get a net profit, so we have achieved that. Your gift and the gift in the past years have provided income that allowed us to offset a portion of the cost to provide transportation for our patients through the caravan transportation program we offer. Your gifts have provided donations for clinical and nursing staff scholarships. For our community wellness programs, we couldn't host those without your donations. You have provided support of our Helping Hands Fund. It's a fund that was established to help staff who may be facing a financial crisis. And you've also provided donations this year and with past gifts to purchase things like the Billy Rubin check desk for our OB department. And I don't know if Rick Jessamine is here, but I would like to extend a thank you to New England Wire. They have consistently been supporting the OB department here at LRH for maybe 10 plus years. Every year making a donation to make it a better department. Another big item that we were able to purchase this year is 2 simulation model, an adult and an infant mannequin, I call them. And they breathe like we do. They do just about everything that we do. And the clinical staff and the nursing staff and physicians here at LRH will benefit from those mannequins. They use them for ongoing training and will do so for many years. Another, we also have endowment funds that were established for specific areas of the hospital. The Francis Heald and Mary Mooney Fund were both established to support the volunteer program. So every year we are able to take the interest from that fund and offset the expenses of the volunteer department. One other thing this year, Paul McGoldrick, as many of you may know, provided a very healthy endowment fund, and the interest from that is to support our oncology department. And I don't know if anyone from oncology is here, but we were able to purchase some new furniture, some new things that made patient care a little bit better. So that's just an idea of what we're able to do with those funds. I can't say too much, but this year our fundraising may pick up the pace a little bit, and we may be raising additional money for some fun projects and exciting projects here at LRH. I didn't spill the beans, Bob. So again, thank you very much for your support. Anytime if you have any questions about fundraising, be sure to let me know. Take care.
Hi, I'm Lori Morgan. I'm the new president of the Hospital Auxiliary. What does the auxiliary do? Who are they? Recently, a hospital employee asked me, a lot of people think that it's a group of doctors' wives, do service projects, decorate the hospital. Well, we actually have a very rich history of over 110 years of service to the hospital. So what do we do now besides service projects and decorate? We raise funds to spend on hospital-related projects. Many of the small fundraisers, including sales and raffles, but our biggest fundraiser is the Moose Ledge gift shop and kiosk. Every time you spend money at the gift shop or at one of our sales or events, you are donating to a very worthwhile cause. My dress, my jewelry, gift shop. I donate to it too. We don't just hand the money over that we make and give it to the hospital and tell them, do what you think you need to do. We choose the projects we donate to. Just to name a few, there's a Born to Read program that provides books for children that they receive at their WellCare visits from our pediatricians. We supply sweatsuits for the emergency department and other patients who are needing a change of clothes so they'll be able to go home. We donate $10,000 to support the caravan to provide transportation for patients to come to appointments and to go back home for the appointments. And this past year we gave $17,000 in scholarships to local high school students and LRH employees pursuing careers and furthering education in the healthcare field. I could go on all night about the great works that the auxiliary does, but I think they just get the hook and drag me out of the building. There's a lot more that Bob needs to talk about. But I will end with is an invitation for you to join our organization. It's not just women, and there's over 125 of us. If you have any questions, you can see me after the meeting. But before I say, here's Bob Nutter, I've got a check for $10,000 for him for the caravan program. Open it up. See, there's really, there's something in there. Read it.
Well, I think that brings it to me now. So thank you very much, Lori. As I think you just saw, we have a very, very impressive group of people that continue to work here. We're adding to that. And I'm just pleased to be the CEO of this organization of such great people and doctors and staff. It's really an amazing place to be, so very, very special. I'd like to start by talking about what our mission is, and we've already heard that a couple times from a few of the presenters earlier. But our mission is to provide quality, compassionate, and accessible health care in a manner that brings value to all. So we listen to the community, we're trying to always figure out how do we improve, how do we work on things that are needed. We start by doing a community health needs assessment. Every couple of years, we have to go through a process, and we try to ask the questions with our healthcare partners in here, including Amanusa Community Health. I did see some folks in here from there. And we partnered with them as well as others to do a community health needs assessment for the region. And from there, we actually start making decisions about where this organization is going to go, what services we need to add, what are you asking for? So we do a real good job trying to listen, and then it takes time to actually build those services in there. But we're going to talk about that in a second. Our vision hasn't changed. It still is that we will be the leading provider of healthcare and the best organization in which to work. So we're not perfect, but we strive to be. We always try to make it every day just a little better than it was the day before, for our patients, for our colleagues, and then for the community as a whole. So we really try to work on that. And so driving us really are our value system. We simply call it ICARE, which is integrity, compassion, accountability, respect, and excellence. So that kind of helps drives everything that we're trying to do. We try to stay focused on that. And so as we start today, or in my comments now, I wanted to talk a little bit and remind everybody, these are our values. This is what we strive to do every single day. So you heard about some of the major accomplishments that we had, and I'm not going to go over every bit of the details that you just heard, but we are really proud of the work that we've been able to do with our folks, with our friends down in Dartmouth-Hitchcock. We're actually able to bring services here, either through tele or through visiting services through Dartmouth, so that we can actually provide that level of care that you otherwise would have to drive an hour and a half south to get, where we can actually see if we can bring those specialists up here. We've grown to a point that we have enough volume to actually bring those specialists up to Littleton twice a month, sometimes once a week, but we're able to access their whole care group and provide services close to home for folks. And then if follow-up testing needs to be done down at Dartmouth, then that we don't offer currently here, then you'd have to go there for those services. But your care comes right back home to this hospital. So we've been working really hard over the last 3 years and before in trying to forge this relationship, and we're very, very pleased to be able to offer that to this community. We did open our urgent care facility. When I first interviewed for a job here, that was one of the things that Aaron and Roger and Jeff and many others had said, this has been a goal of the board for about 10 years to do. And I came from a place where I was able to do this and for another hospital. And so we were very fortunate to be able to do this. And we did open up, and we're doing great. And we've got a great group of folks that are working over there, providers. But we're learning. It's a new service for us. It's a new service for the community. And a lot of the community doesn't even know the difference. What do you use an urgent care for versus an emergency department? And so we're constantly reminding people and realizing sometimes the best place to go isn't in urgent care. You really need to be cared for in an emergency situation. But sometimes it's the other way. Sometimes they appear in our emergency department and they can actually be in an urgent care. So we're actually able to float people very easily between our two services that we offer here in this facility. Our urgent care is right outside the room, and as we get done, feel free to take a look in there. They're going to kill me for saying that. It's a small place, but we do a lot of business in that area right there. And we're also very, very pleased to be one of 9 doorways for the state when it comes to our behavioral health and our MAT and addiction problems. So we were selected through the state. They picked 9 locations throughout the state. And we've really been a good partner in there. Jared Stern, there's our VP that's over that area, has done a great job at leading that for us. Jared, you and your team have done a terrific job, so thank you very much for all that you're doing. Caring for folks that sometimes are forgotten. And we have to realize there's such an important service that we need to provide to this community. So I do give credit to the state and to the governor for actually having the vision to do this. We are making a difference in people's lives. Well over 200 folks that are part of our service in that clinic, and we're really helping people. So it makes me feel really, really good that we're able to provide that level of service to our community and our friends. Other major accomplishments we had, we did open our North Conway, our North Conway facility, and that's doing just great over there. We did complete our Medicaid CMS survey, so that's when the state and the feds come in. They take a look to see, are you meeting all the standards that you need to as a hospital?
Are you complying with all the regulations that we have? And believe me, in healthcare, there's a million. I might be understating that. There's probably more than a million. We were very pleased with the results of that. The surveyors that came to us really talked about how great this hospital is and the services that we provide. We don't really do a great job bragging on ourselves out there. This is like one time a year I get to do that. I'm so proud of the team that led this effort. I think many of us were actually out of the facility. They came at a time that they knew a few of us were at a conference. They always do that too. But we did a great job. The staff did a terrific job with that. And we implemented meds to beds. So what is meds to beds? So we opened our own pharmacy last year, and we actually have developed a program that when a patient comes to see us, we're able to go to the bedside and start reviewing their other meds that they're on, or talk about if they have to be discharged with a prescription. We can actually fill that prescription and bring it to your bedside before you actually leave the hospital. That stops people from having to stop on the way home, wait 45 minutes, or even discuss your pharmaceutical issues with your neighbors that are also refilling a prescription. So we find it's a superior model. The folks that have taken advantage of that have really provided some great compliments to us. And that's a program we're going to continue to grow in this region. So that's great. We talked earlier about some of the services that we offer. These are the services that we offer at this hospital. This is an ever-growing list. So every year we're adding more and more services, even if they're just twice a month services, or if they're once a week services, or they're 5-day-a-week services. So these are all areas that you don't have to travel out of this region to get care. And that's because of the great providers that you have in this room right here. Yes, it's backed up and supported by facilities, that's important. We keep reinvesting in making sure we have the most state-of-the-art equipment and facilities to provide that level of care. But this is an impressive list, and I think Roger mentioned that in his opening remarks too. It's very unusual to see this number of services in any critical access hospital anywhere in this country. We happen to be one of the largest, so we're able to provide that, but it's because of the needs of the community, and we figured a cost-effective way to do that. We don't have to hire that physician here full-time. We can actually just have them rotate and come up to see us when we can fill a physician's schedule for them. It's working out great for Dartmouth, it's working out great for us, and it's really working, most importantly, out for our community. So I'm very, very pleased with this, and we're going to continue to work on these services, all based on the feedback you provide to us. So keep those comments coming. They really do make a difference to us, and it does help us shape what we're going to be providing in the future as well. So this is kind of some of the more bigger news that we're here to announce today. But after going through the process that Roger described with the HALSA advisors, with our board, with our community members, we've come up with a strategic plan. And the board's asked me to move ahead and investigate the next step in meeting those needs that were identified in that community health needs assessment, as well as in our strategic plan. And so there are two major issues that we have uncovered in this hospital, and you heard a little bit about those from prior speakers already. Privacy is a big deal. Having a curtain wall, if you're in the emergency department, between you and a neighbor isn't necessarily what I would consider optimal care. You have HIPAA issues, which is the privacy of health information. You really don't need to be in a place where you need to be in a place where you feel positive that you can talk to your doctor or your provider about what's going on, so we can provide you the best possible care. So that's really what we're saying is, how do we cure that? How do we fix that? At the same time, in our emergency department, how can we also make room and make a special place where we can take care of patients with behavioral health problems? Right now, they currently are just anywhere in the hospital or anywhere in our emergency department. But we had to think, is there a better way to provide that care? And we've spent a lot of time and energy thinking about how that might be, and we're here today to announce the plans that we actually have to accomplish that, all subject to final board approval and state approvals and so forth. But we're very pleased to talk about that. All of our rooms, we're planning to increase our bed capacity in our emergency department from 10 to 16. So why do we have to do that? We've studied the numbers that Roger talked about, the stuff that Aaron's talking about. You see the graphs keep showing the volume growth that we continue to have here. We need to be able to meet the needs of our community, not just where we are today, but think 5 years and 10 years into the future, and what are the needs that we're going to have. Littleton as a community continues to grow. It's robust. It's a great place to be. And as people continue to move in here, they're going to need more services. We're going to need to be able to care for them in a better way. And so we're going to do that. And so, as I just said, we have dedicated rooms also for behavioral health. The next slide that we have actually talks about the addition we're planning on making in our emergency department, all subject to approvals, which actually, and as we look at this preliminary, I can tell you this has already changed too. So as of Friday, we had another pass on this. So we're getting involved from our staff and from physicians and community members to say, you know, how do we best meet your needs out there? And we're adjusting these plans accordingly. So if we go back one slide, just real quick on here. So as you see, we will have an area that will also take care of the behavioral side in a kind of a unique area, as well as an area of patients of size. So we have more and more of our population that need some special care, and so we need to make sure we have the facilities to care for that as well. But effectively with the emergency department, almost every part of the emergency department is going to go through a full renovation, and we will be able to have all private rooms for everyone in the future. This is kind of an outside picture because people like pictures of what it might look like. It won't look like this, it'll look something like this, but we're basically taking the footprint we had. And the folks that actually designed this hospital originally, back 17 years ago, did a super good job at planning for the future. So they actually made it so that we could add on to this facility without huge additional expenses. So credit to the leadership that was here and the board that was here at the time. We did that because it makes our job today easier. And the same thing for the next 10 years, someone's going to look and say, boy, we need to change again. We want to make sure that we do the same thing and anticipate what that future need might be as well. So it looks something like this, but that colored brick area is the part that we'll be making an addition on. And then we're also making some changes in the inpatient units that we have here too. Based on the type of patients that we see in this hospital, we realize that there's more and more surgical patients that we have here. And a lot of that care doesn't need to be in what we consider an acute inpatient. They're really observation patients. So in the future, that's how we're reimbursed. So we need to make sure that we have a more effective way that we can care for patients and the number of patients we have. Having double rooms where you actually have 2 patients in one room, we don't think is optimal care. It's not from an infection control standpoint or from a privacy standpoint or all the other reasons that the specialists will tell you, the doctors will tell you. There's plenty of reasons for that. So we've decided to take a new step in this and say, let's have all private patient rooms here. So you'll never have to share with somebody else again. There's no one else that can really say that and devote to that area. We also want to renovate our existing hospice suite. We do such a great job with the beginning of life here. And the Sauter Birthing Center, if you haven't seen it, you ought to walk through. It is just an amazing place to welcome people to the world. And it's just a wonderful place. We can do even better on hospice care on the other end of that spectrum. And so the board has challenged management to come up with a plan where we can actually build a suite within the hospital so that we can have family and the patient stay in a suite and stay together in a more robust way than we're currently providing today. So we're real excited about that. And I really credit the board for pushing us into those ideas. And we talked about the observation unit. So what might that look like? It might look something like this. And so I'm going to point to the screen in a second and stop on the mic. But there's a whole new section in the bottom right part of this that will be an addition that we'll add on there. No problem. So this is the area we're referring to. And as we add those patient rooms on for an observation unit, we're also going to go back through and update our existing rooms to the same finishes and standards that we have. And so by the time we're done, we'll remodernize an already very modern hospital just to stay on top of that. And that might be what it looks like with the addition coming off the existing wing over there too. So directionally, this is where that will be. Again, it provides space for us in the future. If there's additions that will be needed in the future, we'll also be able to make those additions as well. And that brings us to the end. So we're really happy to take any questions that you might have. I do realize we're standing between you and an unbelievable food service production these guys do every year. I appreciate your patience during the first part of that last minute, but we did want to make sure that we could address the current event that was going on with the coronavirus. Any questions at all for Roger, myself, or anyone? Yes?
What are we looking at in terms of dollar investments for the first part of it?
Yeah, the two projects combined, we're estimating to be around $10 to $11 million.
And what's the timeline for construction beginning, something like that?
Yeah, so that's all pending all the approvals and so forth that we need to go through. So right now we have conceptual design. So the question was timing and the cost. So the cost is going to be 10 to 11 million, and the timing could be we could break ground sometime before the end of this fiscal year, or this calendar year, or it might leak into the next year a little bit. It all depends on how many more iterations of the planning we have to go through. Yeah. Great. Other questions? Well, thank you very much for coming out tonight. It's great to see so many friendly faces, and please enjoy heavy hors d'oeuvres and a great setup our food service team does. Thank you very much.